All right, my name is Gautam Deshpande. I'm an internal medicine physician from the University of Hawaii and also St. Luke's International Hospital. Today my lecture is going to be on presenting a great case in English or Japanese. Now, case presentation, as you guys know, is really important for the development of all young physicians. It's the way that we talk to each other. It's our medical language. So it's a key skill that you guys will practice again and again and again. The objectives of today's lecture are a couple. One, I really want to show you that doing an excellent case presentation is the same in English as it is in Japanese. There's really no difference. If you get it in one language, you'll get it in another. To demonstrate some ways to think about how to present a case before you start, I want to review the order of a case presentation, and I want to review the items in the case presentation. Those are the four basic things that we're going to do today. I want to encourage you to ask any questions if you have any along the way. My first question for the Japanese audience is, are you scared of English? I know I'm kind of scared of Japanese, sukoshi. My answer, if you are, is it's natural, but don't be. Don't be. The components of a case in English and Japanese are the same. Nothing changes when you do it in Japanese or in English except the language. Patients are the same all over the world. The way they present, same all over the world. And the things that we do to work them up are also the same, the way we think about those things. Think about your case in Japanese first. That will help you. It'll calm you down. It'll help you organize the information. And then, in your mind, simply translate it over to English. Finally, prepare before your presentation. I can't really teach you in one session how to do a great case presentation. If you have something like a DVD, it really helps because you can kind of watch it again and again. But ultimately, the way that you guys are going to be excellent case presenters in Japan, at St. Luke's, in Okinawa, in Europe, in America, or at an international conference is just by doing it again and again and again. Renshu, 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 and more renshu. All right? Remember your goal. The goal is to effectively communicate your patient's problems to an English-speaking colleague. Now notice that I don't say fluently, I don't say perfectly, because really, that matters a whole lot less. As long as you can effectively communicate with hand gestures, with your face, with your vocabulary, that's what really counts. Effective communication. Before you get started doing a case presentation, it's really good to sort of have a framework, how you're going to organize the information. And I like to use two analogies for presenting, especially the history of present illness. Two framework analogies. The first one is painting a picture. All right? Painting a picture, just like Van Gogh or Monet or Manet or whoever would paint one of their masterpieces. The second is telling a story. And not just telling a story, but kind of describing a movie. All right? Describing some kind of movie, as if you were talking with a friend and describing the contents of that movie. Okay? Let's take the first example first, painting a picture. Right? This is an especially good analogy for the HPI, the history of present illness. You're starting with a blank canvas, right? The person that you're presenting to doesn't know anything. And you want to start off using broad strokes to explain the basic premise of what you're telling. When an artist paints a picture, they start with a blank canvas and then they put a big green splotch and a big blue splotch to kind of get a feeling of what's going to go later. And that's the same thing that you want to do to build up the story, build up the painting when you're talking to somebody. Example. Broad strokes, 93-year-old woman comes to the ER after losing consciousness. She's had a fever for the last 2 days, right?